Good evening, Thunder Bay, and welcome to a live town hall broadcast with Mayor Bill Mauro and Dr. Janet DeMille of the Thunder Bay District Health Unit. Tonight, you'll be able to submit your questions live via telephone by calling 625-3106 or online by visiting thunderbay.ca/coronavirus. Please welcome your hosts for tonight's live event, Mayor Bill Mauro and Dr. Janet DeMille.
Well, good evening, Thunder Bay. Thank you for joining us. My name is Bill Mauro. I'm Mayor for the City of Thunder Bay. I am here this evening joined by Dr. Janet DeMille, the Medical Officer of Health for the Thunder Bay District Health Unit. We're both going to just make a couple of opening statements, and then we'll be ready to take your questions. Again, thank you very much for being here. It's important for me as well to have Dr. DeMille here with us this evening. From the beginning of this pandemic situation that we find ourselves in, it's been very important for me as mayor of the city to be as informed as I can when it comes to the medical opinion of the professionals in the area. As I was involved in decisions that I would be making or that I was part of making, I really understood very clearly that it needed to be, and those opinions and decisions needed to be informed by professional medical advice. And from the very beginning, late in January, I paid a visit to Dr. DeMille in that regard to start the process of my learning to inform the decision making that I would make in the weeks and the months ahead. As well, one of the concerns that I've had from the very beginning is the capacity of our hospital system in Thunder Bay, but not only in Thunder Bay, but in northwestern Ontario, and understanding that the decisions that we were making as a municipality had at least those two fundamentals at heart all the time, as well as, of course, the health and safety of the people of the City of Thunder Bay and our frontline employees. So thanks again for joining us. We've got your attention, I hope, for a full hour from now up until close to around 8 o'clock this evening. And I'm going to just now turn to Dr. DeMille and ask her if she's got a few questions or opening statement that she'd like to add before we take your first question. Thank you.
Thank you very much, Mr. Mayor. It's really a pleasure to be here. And unfortunate circumstances that we have to be together, but and I just want to start off by noting how challenging these times are. We are facing something that is really unprecedented, both for the globe, the whole world really, and certainly for us up here. And as you've indicated, this is happening very quickly. We didn't even know about this virus 4 months ago, and a lot has happened since that time. And of course, the virus is now here in the community. And these are difficult times. These are challenging times, and I really appreciate the opportunity to be here, to be with you, Mr. Mayor, and to be able to answer your questions.
Okay, I think we're ready for the first question now.
Okay, and the first question is for you, Mayor Mauro. It's from Samantha. And her question is, I ride the buses and social distancing is not being practiced because there isn't enough space for the riders.
Well, Samantha, thank you. If you're with us this evening, thank you very much for the question. About a few weeks back, the city made a number of decisions when it came to the provision of transit service in the city of Thunder Bay. As people will appreciate, the province has made a decision that transit is an essential service. And so for that reason, the City of Thunder Bay continues to provide transit. We understand how important it is to people that need it, that don't have an automobile, that need to get to medical appointments, that need to get to work, etc. So we are continuing to provide service, but we have made decisions around the routes and some service reduction. First, I want to thank very much, if I can, our transit operators. One of the things I think that keeps many of us awake at night is the safety and security of our frontline employees. And obviously, the transit operators are on the front lines of an essential service provision in the City of Thunder Bay. So we want to thank them for their work. One of the decisions and choices that the city made early on when it came to transit was a decision to make the transit service free. And the reason we did that was that people using the service would no longer have to board from the front of the bus. They could board from the back of the bus, and we were hopeful that that would have some enhanced opportunity to provide for the health and safety of our transit operators. Additionally, as we moved forward with decision making when it came to transit, we have, as a result of significantly reduced ridership, we have amended a number of routes in the city where we have actually reduced and or canceled service on certain routes because of reduced ridership. But we've made a decision now that will allow for that capacity that was formerly on routes that were being underutilized to be added to some of the routes, and we do have some that are still heavily utilized. That capacity from those underutilized routes can now be moved on to the routes that are being more utilized. And so it's our hope that that increased capacity, more buses on heavily used routes, can lead to, back to the threading back to your question, Samantha, allowing for an ability to better social distancing when it comes to that issue. When we dealt with this, we've delegated authority to the management of transit, and so that they're able to be more flexible in their decision making when it comes to where they're going to provide the capacity that's been freed up by the reduced ridership. So we take that responsibility very seriously, and we thank you for your question. Thank you very much.
Next question is for Dr. DeMille, and it's from David. Dr. DeMille, will surgical masks or makeshift masks likely be the norm in the near future?
So that's a very good question, actually, and certainly it's been a hotly debated question about the use of masks or face covering as part of our response to this pandemic. I'll start off, though, by noting that surgical masks are and the importance of surgical masks for healthcare workers. And we know that there is definitely issues around the supply of what we call personal protective equipment for healthcare workers, and that includes such things as surgical masks. So one of the things is, if you have surgical masks available, if you have them for yourself, consider donating them to the hospital or to healthcare organizations, just because of the importance that those kind of supplies are available to frontline healthcare workers during the challenging times. I'll comment, though, on various types of makeshift masks, so ones that you can make yourself, or even make out of something like a bandana, and certainly there's a lot of information about that on the internet about how to make that, and there's also information, by the way, on the Health Unit website. Wearing masks when you're out in the community or in the public actually benefits other people. So if for example, somebody had COVID, even if early stages of COVID, and they were wearing a mask, then that actually prevents the droplets that are carrying the virus getting expelled into the environment around that person, where they can then contaminate the environmental services. Or if somebody were to be standing close to them, those droplets could potentially go onto somebody else, and that would be, they would potentially get infected with that virus. But if you're wearing a mask, when you have COVID, you're much less likely to transmit it that way. So it does protect other people. In terms of the evidence around whether it actually helps in this kind of context, we do know that one of the most important things to do to prevent transmitting to somebody, like if I had it and not transmit to the mayor, for example, is actually to maintain that 2-meter distance between people. That is the number one thing that I would recommend when you're out in public in terms of preventing that transmission to other people. And of course, the usual, washing your hands, for example, and coughing into your sleeve so it's not, those droplets aren't going out. However, if you want to wear a mask, there's really no problems with it, as long as you're not compromising that physical distancing. Just be careful when you wear the mask that you put it on properly, that you take it off properly as well. If you can imagine, if it has virus on it, you don't want to take off the mask, but contaminate or get it near your mouth or your nose when you're taking it off, because you'll just end up contaminating yourself. So using it properly, it's okay to do. It's maybe appropriate to use in places where you can't maintain that 2-meter distance. I think actually, in terms of our experiences here in Thunder Bay, we don't necessarily have sort of a lot of crowded spaces, and so it may not become the norm per se, but I think people should feel comfortable wearing one if they want to.
And maybe if I could, I would just add a thought or two as well when it comes to personal protective equipment. I know that the City of Thunder Bay is receiving a lot of interest and requests when it comes to the supply of PPE. I would mention that last night at Council that we moved a resolution relative to work that's being done at the provincial level. Some of you may be familiar with the province and the Supply Chain Management Act that's come into force. At the provincial level, basically the province will be setting up a priority list in terms of distribution of PPE. We moved a resolution last night ensuring as best we're able that the province will remain cognizant of the frontline workers that work for the City of Thunder Bay, as well as the frontline workers that work in the healthcare sector. So as well, we have a table set up municipally where they're doing what they can to try and secure on their own personal protective equipment. So a lot of organizations, individual employers are doing what they can on this front. And a shout out as well to MP Pulowski and Bombardier. We know that they will be involved in the production of ventilators here in Thunder Bay, so some good work going on there as well. So thank you for your answer, Dr. DeMille, as well. The next question.
The next question is for you, Mayor Mauro, and it's from Orville. What is the city doing to house and protect the homeless in our city?
Well, Orville, thank you for your question. The lead from the city's perspective, even before the pandemic took hold globally, and also in our emergency plan, is the DSAB, the District Social Services Administration Board. They're a professional organization. They are an independent outside organization. They are not under the care and control of the City of Thunder Bay. They are mandated and they are funded to do this work. And so from the city's perspective, they are the lead agency when it comes to this particular work. The City of Thunder Bay has tables set up that are doing work, that are trying to provide some coordinating ability to the DSAB and supports where necessary. So that work is going on. Important to note also that beyond the DSAB, there are a number of other organizations in the City of Thunder Bay that are doing this work and providing supports. For example, Lakehead Social Planning Council, I know, has received some funding to do some of this kind of work. The Thunder Bay Indigenous Friendship Center has received funding to do this work. We know, of course, that Shelter House is engaged and is doing work. So there's a lot of other organizations besides the DSAB. We know as well that DSAB has received money. The province has announced a new fund. I think it's called the Social Services Relief Fund. Money is flowing now, new incremental money, to organizations like the DSAB to help them with this very issue, with the homeless population, to be able to achieve isolation. Through the fund that I just referenced, the DSAB has to this point received $585,000 new dollars. The expectation is they will receive even more funding than that in the weeks and months ahead. And they've secured about 170 hotel rooms now to begin doing that work as well. So there's a lot going on in that regard. And perhaps the last piece that I would mention in that context as well is that the City of Thunder Bay at our March 30th meeting has set aside an additional $235,000. We have a fund called the Community Youth and Cultural Funding Program that allows for about $2.7 million each year to go out to a lot of organizations that do good work, charitable work, nonprofit organizations in the City of Thunder Bay. They get funded to about $2.7 million per year. At our meeting on March 30th, we added to that $235,000, so there'll be some additional money there that will likely find its way to some of these organizations as well. I would add there's a lot of work going on municipally to help others in the community when it comes to food security. I know your question, Orville, was focused on homeless population, but there's a lot of great work that's going on when it comes to food security in the community as well, and I'd like to give a shout out to those organizations also. Thank you.
Yeah.
Dr. DeMille, did you want to add something?
I just want to recognize how important that question is, because we know that the homeless population or marginally housed population is is an at-risk population. And when you look at what's happening in other parts of the province, like in Toronto, there are outbreaks of COVID in that population. So it's very important to put all the appropriate measures in place to prepare for that possibility here. And I think, as the mayor already indicated, there's a number of partners already involved, including the health unit and other healthcare partners, to ensuring that that those individuals who are homeless have the supports and the structures in place to be able to effectively get through this pandemic. And I will note some particular things that we're looking at the health unit is actually being able to increase testing in that population to ensure that testing is available, and That includes through health unit programming, but also the Superior North EMS Community Paramedicine program. And also recognizing the importance that individuals who are self-isolating or who are experiencing the illness of COVID-19 will also need some healthcare supports and some mental health supports, and those are being put together. And I just want to acknowledge partners like the St. Joe's Care Group, Norwest Community Health Center, along with that, as well as the shelter providers, Grace Place and Shelter House and Salvation Army, among others, who are all participating in this response.
Okay.
Okay, the next question is for you, Dr. DeMille, and it comes from Janet, actually. I live in a multi-unit apartment building, and despite notices on the doors and elevator, one apartment insists on hosting multiple guests on a daily basis. They arrive in groups of 2 and 3, no social distancing observed. What can we do?
Okay. So I think you've sort of indicated that there's potential that people are gathering in groups, or that there's a lot of people being in close proximity to one another. And certainly that's something that the health unit is working on addressing in a number of different ways. So if you have particular concerns about your location, in this case an apartment building, do feel free to phone the health unit, the enforcement line that we have. During the day, 7 days a week, you can reach a public health inspector who are following up on these complaints and enforcing as much as we are able on these types of complaints and others. So if people are violating, in this case, the limit on gathering, which is we're currently limited to 5 people. So if people are sort of going over and above that, that would be inappropriate and something that we would definitely follow up on. However, it's also, we have done work specifically with apartments and multi-use dwellings to support the management of those places, to put in appropriate measures like signage, for example, and to look at how they can support the physical distancing within those apartment buildings. And so certainly that's one of the ways we will do what, in terms of when we respond, we will follow up on the particular complaint, perhaps with the tenant directly, for example, but we can also follow up with the management of that apartment building to making sure that they're aware and knowledgeable about, the measures that we want them to put into place and support them in being able to do that. So thank you for that question.
Thank you, Dr. DeMille. I think if I could as well, I think it's important for the community to know that they do have options, and thank you to Dr. DeMille for her answer and response on this. And perhaps just to talk a little bit in connection to this question about enforcement. From my perspective, I think it's important that the community is aware that there is a relief valve for those frustrations available to them. I said weeks ago when I was asked this question, I responded by saying, well, if we're enforcing, we're losing. And my point was that would imply that the message is not getting through. I think at this point I'm feeling more comfortable, and perhaps Dr. DeMille is as well, that enough people, or a lot of people in the community, really do grasp the seriousness of this, and that physical distancing is the tool that we have to mitigate the spread. But at the same time, I hear regularly, and I think others as well, that there are still people in the community who don't seem to be adhering to this physical distancing principle, and it's a real concern. As the weather warms and more people begin to go outside, I'm worried that it may even get more serious, where we will see more examples, potentially, of people who are not adhering to this physical distancing principle. And so for that reason, I wanted to, and we did a media piece about a week or two ago, on enforcement and what is available to you. Now, the Thunder Bay District Health Unit is the lead. There's a 1-800 or 1-866 number or something that you can call to report and have tried to be addressed. The City of Thunder Bay, I should make note as well, has amended and brought our bylaw officers into the fold as well to support the work of the Thunder Bay District Health Unit. The police are there. We don't want you calling police when it comes to this issue. The other numbers that are available would please be your first recourse. But it's important for me to let you know that you have an option. You have a relief valve for that frustration. Please utilize it. There are fines that are available. A number of municipalities and organizations, I shouldn't say municipalities, are levying fines. We don't want that to be the natural course of business. But if people are not getting this message, and we understand that if you're not adhering to physical distancing, that you could be responsible for the spread of this virus. At the end of the day, we need to do everything that we can to mitigate as best we can against that. So it's important that people are aware of that. You'll find that information on the city website, or I would guess at the Thunder Bay District Health Unit website as well. Thank you.
If I may, actually, I'll just add a little bit more, because we talked about the sort of apartment buildings, and I mentioned the gatherings. We also look at other orders under the Emergency Management and Civil Protection Act, including the businesses that are supposed to be closed, that are deemed sort of non-essential. So we can follow up and have followed up on businesses who are open but they shouldn't be open. As well, we follow up on any violations of the Quarantine Act. That was the federal order issued by Minister Haidu related to people when they return to Canada. They need to self-isolate for 14 days, and we do follow up on that. We also follow up on any issues related to outdoor play structures, for example, or park areas, and making sure that all the appropriate measures are supposed to be under that piece of legislation. So.
Okay, thank you for that. The next question is for Mayor Mauro, and it comes from Robert. The question is, now that the warmer weather is here, is there any way that the fire ban can be lifted?
Robert, thank you for the question. It's actually, I'm happy that you've brought this question forward. I think there's a bit of uncertainty in the community as to what's gone on in this respect. So the City of Thunder Bay has been captured in a provincial order relative to this fire ban. The provincial order does not apply to the entire province, but it has captured the City of Thunder Bay within it. And so the order that is not allowing for that backyard fire pit for you to get a permit to go off and be able to do that, it's not the city purview. Now, the city did, after the provincial order came out, put out a release advising people. It was a notification piece on behalf of the city more than anything else, but I think it created some uncertainty where for some people they thought that it was the City of Thunder Bay that was making the decision to ban the outdoor fires. It's not. It's the result of a provincial order that applies to large sections of the province of Ontario, not the entire province. And so we find ourselves constrained in terms of that position. It would be my expectation that the province has made this decision for reasons of their own, but also to ensure as best they're able that the resources while we're in this pandemic situation are available to deal with matters related to the pandemic. So the decision on that rests with the province. I would expect that maybe this is an opportune time to mention the emergency order that the province has had in place has been extended to May 12th. And so all of the provincial orders that have been put in place to this point remain in effect up until May 12th. I would begin to think that as we approach May 12th, we may start to see some changes around some of the decisions that constrain the ability of the municipality to provide certain services. Constrain maybe being the wrong reason. I mean, they're done for good reason and with good intent. But that's the answer on the fire ban right now, Robert. So it's within the purview of the province of Ontario, and if they make a decision, then obviously we would move on it as well. Thank you for the question.
Okay, the next question is for Dr. DeMille, and it comes from Jennifer. It's wonderful that there was the opportunity for additional testing in Thunder Bay this past weekend for those exhibiting symptoms. Are there plans for more COVID-19 testing and antibody testing to gauge where the virus is in Thunder Bay?
Well, I'm glad you asked that question. That seems to be my favorite topic these days, is about testing. So thank you very much, Jennifer, for that question. And I think we did have a very successful drive-through testing opportunity at the main office of the health unit this weekend with, again, the community paramedicine program. And I think it was testing between, close to 300 people, which I think was very exciting. As you may know, actually, testing is really important as part of understanding what's going on in the community with respect to the virus, and certainly as well identifying individuals who have the virus, who have COVID-19, so that we can effectively follow up with them and try to contain it, so reduce the spread from individuals who have it. And that's certainly a very important part of the public health mandate. Testing has been challenged, though, because of various reasons, sort of testing capacity. First, it was the availability of swabs and having the appropriate swabs available to do the test. And there was a global supply issues even related to the swabs. And then there is about being able to analyze the swabs. So when the specimen is taken, to be able to analyze that. And there were certainly some challenges related to that. And then, of course, wanting to get those results back quickly. So what we call the turnaround time. So between the time the swab is taken and being able to get the results, we have had times where it was fairly extended. So we have been challenged around being able to do the kind of testing that we would like to do, given the current circumstances. I'm really pleased to say, though, that has changed. A lot of work has been done provincially, so we have better capacity across the province to be able to do more testing. Certainly the swab supply right now, at least, is fairly good, and testing capacity has increased. And I'll note even last week with Dr. Kennedy at the hospital, we were both working together to try to increase, the capacity to actually analyze the tests here. And the Thunder Bay Regional has some capacity now to be able to do that. And we're looking at the public health lab here to be able to have some testing. So lots of opportunity moving forward. With respect, though, to what's available now, so we are having another drive-through event this Saturday and Sunday. It's going to be based on the same model that we had good success with last time. So that will be at the Health Unit main office here in Thunder Bay, and with the Community Paramedicine Program. I'll also point out that the assessment center, the COVID-19 assessment center that is operated from the Thunder Bay Regional Health Sciences Center, has also expanded the number of people that they can accommodate there. So that remains an opportunity. We've always used them ever since that facility was opened, and certainly have greater opportunities with them. We also have the Community Paramedicine Program that can actually go to people's homes or to a particular location to do the testing. And the way to access all of those testing opportunities is by calling the health unit. So you call, we have a call center set up, and you could explain your situation and why you might want to test, like what symptoms you might have. And we can work with you to figure out which option might suit you best, but depending on the need. So either referral to the hospital's assessment center, community paramedicine if potentially it's challenging for you to leave the house, or potentially getting an appointment time at our drive-through testing that's coming up. Certainly when we, and I'll note actually that it's not only that we have more opportunities to get tested, there's a lower threshold for doing the test. So originally, especially when the capacity was low and the swabs were low, the testing was focused on some of the more significant symptoms of COVID. So we talked about the fever or the cough or shortness of breath primarily. And there was priority groups. So healthcare providers, for example, would be considered a priority group to get tested, or somebody who had traveled. But now the testing criteria, there's a much lower threshold. So you don't need to have a full scope of symptoms. You don't need to be moderately or seriously ill. You could just have minor symptoms and get tested, and that's really important. As well as there's a broader range of priority groups, and in fact the priority groups are really only used when testing is the capacity, if it goes down in any way, when we'll focus more on the priority groups. So there's real opportunity right now. And I would like to, I'd like to acknowledge that the testing is important again, so that we can identify individuals who have COVID, and again work to contain the spread. So with the health unit, we follow up with individuals who are confirmed to have COVID-19, and then we follow up to make sure that anybody who may have acquired the virus from that person, we're also managing and we're supporting and getting them access to testing if they have symptoms too. So that helps contain the virus, limits the spread of the virus in our community. The other reason, though, which I think you alluded to in your question, Jennifer, is the importance of actually getting a better understanding of what's going on in the community. What are the actual rates of COVID-19? It is unfortunately likely that there have been people who've had COVID-19 and we haven't diagnosed them. And I've realized in terms of how when I review cases, when I review the sort of situations and what symptoms people have, COVID can present in a variety of ways, from a very, very mild illness to something that's very severe. And it's quite likely that we've missed a lot of the very mild illnesses because people don't necessarily think or know that they have COVID, and they weren't necessarily tested. So I think doing expanded testing, even of those people with mild illness, will give us a much better idea of what's going on in our community, and it's important to continue. And as I noted before, we're going to be actually, continuing to look at what testing opportunities we want to continue on with. And so certainly looking at, like as I indicated before, homeless or individuals who are homeless or more marginalized, for example. And certainly we're aware that there's going to be more testing in long-term care homes, for example. So we'll be looking at that and continuing broader testing opportunities. Actually, if I can go on, I'll address the antibody question, the other question about being able to do another test. So the current test that we have is done with a swab. It's what's called a nasopharyngeal swab. It goes into the nose, back into the back of the throat, and it gets a little bit of the sample of the stuff that's there. But there's also an opportunity down the road, we don't have it right now, of doing a blood test. And I think that would look for antibodies to the virus, to the COVID-19 virus. And that will be important down the road when we look at trying to get a better understanding of how many people might already have been exposed to COVID. Because again, there's the potential for fairly mild illness or cases that we've missed. And at some point, especially as we move forward and are thinking, into the future and the things we might want to do, it would be quite important to get a bit of a sense of how many people have actually already been exposed that we may not have identified. So okay. Thank you for your question.
The next question is for Mayor Mauro, and it comes from Doug. And the question is, why are city cemeteries closed?
Oh, Doug, yeah, thank you for your question, Doug. So there is a provincial order related to cemeteries that sort of splits the service provision into a couple of different pieces. One, they've fallen into the essential category. So if there is a funeral that needs to occur and take place, the cemeteries are still open and available. The provincial order allows for the funeral to take place up to and including 10 people, including clergy. And so city-run facilities, I'm only talking about, of course, city-owned cemeteries, not privately owned or provincially, those under provincial purview. I'm talking only about the city-owned facilities. You can still accommodate a funeral up to 10 at a city facility. Where it got went a little sideways last Friday, there was a decision that was made that the other part of the service provision, what would be considered non-essential, and that would be just people who are interested in visiting and going into one of the city-owned cemeteries and paying their respects and visiting their loved ones. There was an announcement that was made by administration that was going to cease and that was going to close. That happened and became apparent Friday morning. I called immediately. I asked if that could be revisited. We did some media on it Friday afternoon. I can tell you a number of other councillors as well weighed in on this one. This seemed like it was a decision that perhaps did not need to be made. And so through the efforts of a lot of councillors, we got back over the course of the weekend, asked city admin to revisit this and reconsider this. And you may have seen, Doug, I'm not sure when your question came in, but you may be aware by now that we've revisited this. We put out a press release, I think, yesterday, advising that city cemeteries are still open to visitation. So regular working hours and that service for the time being, at least, will be accommodated and provided.
Okay, thank you. The next question is for Dr. DeMille, and it comes from Darlene. The provincial news on COVID-19 seems to be relevant to Southern Ontario only. Recent articles talk about how Ontario is reaching its peak with COVID-19. How can this be accurate? We haven't even begun to approach the peak in Northern Ontario. I hope medical experts will consider what is needed for Northern Ontario to manage this crisis. What are the plans for the Thunder Bay area and Northern Ontario specifically?
So thank you for that question. That's, I think, in many ways, with the experience of this sort of pandemic and how it's unfolded here in Ontario, there is certainly a lot of news that does come out of Toronto, notably, and certainly the bigger centres, so the GTA and the Ottawa area, for example. And certainly there's a reason for that. That's where COVID certainly made its appearance here in Ontario. And certainly they are, as you've already noted, sort of ahead of the curve or ahead of things. And I've always sort of thought that here we're in Thunder Bay, we're about 1 to 2 weeks behind Toronto. And you know, I think it's important to consider always what our needs are up here and how things might be and should look different as we do them up here compared to down there. So I agree with you. I'm actually going to just give a little promotion to myself, but I mean promotion about myself. I'm actually going to be providing another video update for the community tomorrow, where I'm going to talk a little bit more about more detail about our current situation here and where we are in that curve. And the news that came out of Toronto, or the provincial government on Monday, that talked about being at the peak, which I think you must be alluding to in terms of what your question is about. So I'm going to provide a little bit more information about that here. I think in some ways we've actually benefited from things being a bit more focused on Southern Ontario, and the fact that we're about 1 to 2 weeks behind. So when we talk about all the provincial orders that were put down, we essentially, they were put down very early for us up here in northwestern Ontario and in Thunder Bay. They were almost done on Toronto timelines, is what I would call them. But we actually benefited from that. In other words, the measures were put in place perhaps even before they were really needed. But that's when you want to put these kinds of measures. So when you talk about closing things or reducing gatherings, closing schools, closing the businesses, the issues around the recreation facilities, for example, all the other things that we've seen, I think we've benefited from them in reducing the spread of the virus that is here because they were put in so early. So I think there's some, you know, we've benefited from that. At the same time, I totally agree that we need to think about our situation here and the you know, how we might want to do things here that might be different from how they might approach things down south. And so I really appreciate that question. The previous question that I talked about was about testing, and certainly that's something that I've done, is try to advocate for testing and greater testing up here and an understanding of the limitations of testing. And I was working again with the hospital and Dr. Stuart Kennedy to look at sort of to express and advocate on the behalf of us here, because we don't have that sort of capacity, that lab capacity, and the availability, and the turnaround times, especially, for example, over the long weekend, got a little bit longer because of the swabs had to be transported to Toronto. So certainly that's another thing that we're doing, is always advocating for the Northern Ontario and Northwestern Ontario in particular. And that's, I do have 2 meetings a week with my provincial colleagues and with the offices of the Chief Medical Officer of Health and the Ministry of Health. So that's 2 meetings a week, and I can speak up certainly and make sure that northern perspective is brought into play. And similarly, I also am well connected with my northern colleagues. There are 7 northern health units, and we meet regularly to discuss issues and to put forward, you know, how the north is different and how things might need to be considered differently. And I do feel that we are heard. So I just wanted to, you know, to kind of state that and to reassure you. And as we move forward with all of these measures that are in place, and potentially at some point being able to pull back and to pull back on some of these very significant things that are in place, we'll also be advocating for what does that look like in the north? What does that look like for Northwestern Ontario, for Thunder Bay, and how might we do things a bit differently than what they do down south? So thank you very much for that question, though.
Okay, the next question is for Mayor Mauro, and it comes from Diane. I see elected officials in other municipalities spearheading post-pandemic small business recovery efforts. What is our mayor and council doing now to ensure our small business sector and entrepreneurs, 1, survive, and 2, thrive in a recovery?
Well, Dan, thank you. Thank you for the question. I think a lot of us obviously are very concerned about the ability of our small businesses, our locally owned businesses here in the city of Thunder Bay to get through this crisis. I'm someone who grew up in a small family-run business. I've got great respect for the entrepreneurship and the risk-taking, and have talked often in my media addresses about whatever we can do as a community to support our business sector as we try and get through this very difficult time. At our March 30th meeting, Council made a series of decisions. I would expect the business owners in the community have some sense of what we've done to this point. We made a decision on property tax deferrals on the interim tax from May 6th or so, I think, out into June or July. We've made decisions on deferring the fees on water bills, basically giving a 90-day grace period. There were a series of other smaller measures made in that package. I think some people were probably hoping for more, but I would say at this point, that's where we landed on March 30th. I'd say what we've done to this point is consistent with what most municipalities have done across the province of Ontario. And the reason I say that is that when we were making these decisions, and as I respond to questions that I get from people in the community, I think it's important for the municipality to make our decisions on this type of support in the context of the financial capacity of the provincial and federal governments. We do know that the ability to raise funds at the municipal level is severely limited. We know that the province and the federal government have far greater revenue capacity. And we expect, and we have seen, that the province and the federal government have come forward with a number of programs already. For example, for small business, I know there's a rent program. I don't know the details well. I know federally they've come forward with a wage subsidy program. I don't know for certain if that's in place now or if it's still coming, but certainly the announcements have been made. The province has made some announcements when it comes to similarly trying to support the business sector. So for the municipality, I think it's important for us as we make our decisions on what kind of relief we may bring, and as I've mentioned, our decisions can still be revisited. But it's important that we make them in the context of what has the province done and what has the federal government done. More directly to your question about other municipal officials in other parts of the province doing some work to spearhead and get their economies reopened or restarted, quite frankly, that capacity municipally is very, very limited. Most of the provincial orders that have businesses closed are in fact that. They are provincial orders. The municipalities do not have the capacity to open private sector businesses. Those are closed as the result of provincial orders. There was a headline yesterday about someone in Kingston, a councillor, that said we're going to restart our economy. But if you dive into the story a little bit, the councillor was actually bringing forward a motion asking the province to begin considering relaxing some of the restrictions that are in place. So I think we're all starting to find ourselves moving into a bit of a different time where we're hearing a different language from the province that maybe we're peaked, and maybe in the next week or two we'll start to see ID numbers start to go down, and will the province consider relaxing some of those orders that are restricting the ability for business to get up and running again. So I would put it basically in those three parts. One, what are the province and the feds doing to help businesses? What can the city do? And understanding that we need provincial relaxation of provincial orders for the economy really to begin moving forward again. But please take it very seriously. Anything that we can do. I've had a few calls with the chamber as well. Obviously, our CEDC is still active. When this does get passed in the rearview mirror, when we're getting into that restart phase, obviously the CEDC is still doing their work. Our Community Economic Development Commission is still an active board of the City of Thunder Bay. They're still actively trying to see what they can do. But hang in there. We're all going to do the best that we can by you. And please, if you haven't already, tap into and be in tune to the programs that are in place now at the provincial and federal level. Thank you for your question.
Okay, the next question is for Dr. DeMille. I live alone and my health is not good. I do not have family here or anyone I can count on, and I'm scared to go to the emergency. If I call the health unit, can they come and do a test?
So the quick answer is yes. If you need a COVID-19 test, so you have symptoms, even just one symptom, and you think you might, and certainly if you feel you're at risk or want to know, that you could call the health unit and we could arrange, for example, for a community paramedicine program to go to your home and do the test there. So feel free to do that. I'm sorry to hear about your situation, for sure, and these are challenging times, and I know that could be that could be very challenging if you're alone and need support. I would certainly encourage you and everybody else to ensure that you're taking care, as much as possible of your own physical health and your mental health. These are definitely challenging times. It is very, it's easy to get caught up in the fear and the anxieties and the uncertainties of these times. And, I do hear that a lot, I can certainly appreciate where people are coming from. So be sure to take care of your mental health. There's certainly resources on the health unit website that can help you and sort of access, different opportunities to sort of think about, and other places that you can reach out to for help. Consider, how you can connect with other people. Certainly we have to reduce how much we're, physically together with other people, but there's also lots of opportunities to be socially connected. So don't hesitate to reach out to other people, to seek that support. I've even done that for myself. I had a dinner with my family, my sister and her family in Kingston through that Skype connection or one of those things, and that was actually a really nice opportunity. And think about getting outside as well. If you're not self-isolating, you could certainly get outside, get some exercise, because exercise is good for one's overall physical and mental well-being. So some things to think about there.
Okay, thank you. The next question is for Mayor Mauro, and it comes from Darren. Why has the City of Thunder Bay not declared a state of emergency? Over 240 municipalities and 60 First Nations have already done this across the province. Does not declaring an emergency limit council's ability to respond with adequate resources?
Well, Darren, thanks for the question. You're right, a number of municipalities in the province have already declared an emergency. I think you said in your question 240. There's about 440 municipalities in the province of Ontario, so almost a similar number have not declared an emergency. I think there is a belief in the community that by declaring a number of things really change in a significant way, and quite frankly they don't until just yesterday, and I'll get to that in a second. It's accurate to say that under the Emergency Management and Civil Protection Act, which is provincial legislation, as mayor, I can declare an emergency based on advice or input, but ultimately the decision would be that of me as mayor to make. What authorities or new authorities does it give you? Not really a lot. For example, if we needed to engage volunteers in an emergency situation, then they would be able to get WSIB coverage through the City of Thunder Bay. That would be one reason we could do it. It would allow for circumventing your procurement bylaw, where in other words, if you needed something in a hurry, you could just go buy it. Most municipalities, that would be new. For the City of Thunder Bay, it wouldn't. We already have our own procurement bylaw that allows us to do that, even when we're not in a state of emergency. There is the symbolic value of making a declaration, but I think that people obviously in the City of Thunder Bay understand the seriousness of the situation that we are in right now. But the point where this just becomes a little bit more muddled, I guess is a word I could use, is just yesterday. As a result of a provincial order, a new provincial order that came down either Friday or yesterday or late last week, I forget exactly when it came down, the province has now made it able for municipalities to redeploy staff as they see fit. But the way that the municipality would be able to do that would be only if the mayor of the city has declared an emergency. That's a very serious decision, because what it really means is that management in the City of Thunder Bay would have authority to redeploy staff, notwithstanding whatever collective bargaining agreements may be in place. So I'm being upfront. We had a call about this today. The advice was to me as mayor that I should give consideration to declaring an emergency, understanding the gravity of this. It would not be a power, obviously, that management would use ruthlessly. Obviously, they would do it in conjunction and through conversation with the bargaining agents. You would have to give them a notice before you did some of this work. You would have to have people trained properly in the areas that they were redeployed to. You could not move to an area that paid you less than the job you were being moved out from. So there's a lot of controls in place, but still, it's a very serious order, and I think that's why the province has said, well, Mayor, you're going to have to make a declaration of emergency before we're going to do it. But it is a provincial order that allows for us to do that. So it's put another layer on the declaration of emergency. So it's something that I'm considering now, and will probably make a decision in the near term. The guiding principle now would probably be more around that most recent provincial order than any of the other authorities that would flow as a result of having declared an emergency. But thank you for the question. I hope I didn't confuse you too much with the answer.
Thank you. The next question is for Dr. DeMille, and it comes from Karen. Will spring and summer large events still take place?
So currently, large events would be prohibited under the orders from the Emergency Management Civil Protection Act. So, and that is currently extended until May 12th,
yeah.
right? So that the current version. And gatherings are right now very significantly restricted to like 5 people. So it is, and I think, and we haven't heard what's going to happen after May 12th. And certainly, as we consider, as we look forward into the future, where some of these very significant orders and prohibitions that are currently in place and all the closures, the removal of those things will have to be done very cautiously and very strategically, and in a very phased approach. So there will be some relaxation of some of the measures, and then we'll have to be monitoring for the levels of COVID in the community through testing, for example, as I've already talked about. And then if things are going well, some further restrictions can be removed. So what we would anticipate as we come out of the very significant state we find ourselves in now, I would anticipate that would go through a very phased approach. And much of this will be directed by the province. I mean, I believe we can advocate, or we can sort of bring our perspective to that table, but I think it'll be largely determined out of the province, because that's who's imposing it now. When it comes to, as we, I've even looked at it myself about what are the proposals that are out there, how does one go about doing that in a staged approach. I think that mass gatherings, so some of those large events you're likely alluding to that sort of happen, for example, at the Marina, as one spot here in the city of Thunder Bay, I would imagine that would be something that would be done at a later stage. So I would imagine that initially there would be potentially smaller gatherings that are allowed, but certainly some of those large gatherings, I would anticipate that would be done later in this whole process. So I think I think this will be a different summer. I think this will be a different spring. I think this will be a different summer. And I certainly, it's hard to predict too far ahead, but I'm not sure that those will be allowed to happen, I guess, when I think of that.
Yeah, and I would just add a little bit as well. Thank you, Dr. Mill, for your answer. It's a question that I know I receive often, city administration receives it often. I know city councilors are receiving absolutely that same question. And when you think of city-run events, you think of things like Canada Day, and you think of Summer in the Parks. Clearly, the provincial order around no larger than groups of 5 is the guiding principle here. The distinction, I guess, would be, as Dr. DeMille has underscored for you, is that we're not quite yet at the point where we've made decisions on a number of the city events. Looking forward right now, if we had to guess, we could offer a best guess, but we don't need to do that yet. But there will come a point in the not too distant future where there is so much planning and logistical work that goes into coordinating these events that we will have to make a decision. So at this point it's restricted to the 5. That's the guiding principle. That's why we wouldn't be doing it. But there's still some runway that allows us some opportunity to see if things change. But as it stands right now, it's looking less and less likely that a number of those events would go forward.
Great, thank you. Next question is for Mayor Mauro. It comes from Cherie. We are boaters and have already paid our docking fees this season. Will we be able to use the boat launch at the marina?
Yeah, so there's a couple of pieces to that question. So the municipally owned boat launches are available and open. So Westfort, the marina, those boat launches are available. But when it comes to the marina piece, so if you're somebody that has a berth, I think that's what the question was more about. If you're somebody that has a berth at the marina and you've stored your boat somewhere and you're ready now to put it in the water, you would be able to use the City of Thunder Bay boat launch at the waterfront, but at this point you would not be allowed to berth your boat and take up that spot. That decision at this point is that no, we're not going to offer those marina services. And so it's a bit of an awkward one. If it's someone else who's just a member of the public who wanted to utilize that boat launch, yes, they could. If they wanted to use the Westfort boat launch at this point, yes, they could. The marina piece is still, though, captured in that outdoor rec provincial order. I think I have this right when I would put that in that category of golf courses and other outdoor activities where outdoor rec is basically prohibited. And so at this point, marina, no. Boat launch, yes. And again, the provincial order being extended to May 12th, and we may see some of these decisions revisited and the constraints removed on municipal operations by the province. On some of them, I'm hopeful, because I think some of them we can probably accommodate, understanding still the guiding principles, the health and safety of the public. Thank you for the question.
Okay, the next question is for Dr. DeMille, and it comes from Lori. When is a positive case considered resolved? Is someone with a positive result required to receive more than one negative test before they are considered to no longer be contagious?
Detailed public health question. So there are criteria that we use to determine when somebody would be considered resolved. Some of that actually just relates to a time base. So, for example, 14 days after their onset of symptoms, assuming that they're no longer symptomatic at that time. That's sort of loosely, it's not sort of, my answer is not very detailed, but that could be considered somebody would be resolved at that time. For healthcare workers, including like long-term care workers, there are some other criteria that could be used that would include actually having testing. So another one of those nasopharyngeal swabs, and which goes in the nose, and needing 2 of those to be negative about 24 hours apart before somebody could potentially return to work. But those are specialty, criteria that might be used primarily in a healthcare setting. I think it's important to know that anybody who has COVID-19 will be, a public health nurse will be in touch with that person over the course of their time as they, over the course of their illness. And that public health person will work with the individual to determine when they meet the criteria for that resolution. For some people, it may take a little bit longer, depending on their symptoms and their illness course. For some people, it might be even a little bit shorter, so because they have a much milder illness and they become asymptomatic. So the public health nurse will work with you or anybody who has COVID to make that determination.
Okay, thank you. Then just a few questions left. The next question is for Mayor Mauro, and it comes from Gord. I am a senior who needs a place to sit when out walking. Are there any benches that are still open to the public?
So, Gord, that's a good question. I'm not sure that I have a really good answer for you. I think there's some uncertainty in the community around this issue. I think I'm on solid ground when I say yes, there are. Where we saw, when I talked earlier about outdoor recreational activities where play structures in parks were closed, that was captured in a provincial order. So you You couldn't take your family in, and your children, for example, couldn't use a slide. They couldn't use the swing. Those are limited, and those benches in those parks are limited. But I think I'm on solid ground. But Gord, I apologize. I'm not going to give you an absolute answer. I'll ask you to check back in with us tomorrow. But I do believe that some of the benches that you see dispersed around the community are still able to be utilized. For example, a bus at a transit stop is not taped off. People are still able to utilize them. So there's a bit of a uncertainty, a mixed message, I think, coming from some of the work that the cities are still doing, where you may just have a bench scattered around in the community somewhere, not even necessarily at a transit stop along a riverbank, for example. I believe I'm on solid ground when I'm saying those are available for you to use. I take the concern seriously, though, because if you're transgressing, if it's a transgression, potentially you're at risk of being ticketed. I don't think you would be, but I understand the importance of the question in that context. So I believe you can, but please circle back with us again, and we'll try and make sure that we get you an absolutely right answer on it. Thanks for the question.
Okay, our next question, and I think the last one for Dr. DeMille, comes from Shane. Does getting the flu shot this year help with the coronavirus?
So getting the flu shot, which I would highly recommend, won't actually help you with coronavirus. So the influenza and coronavirus, while they both cause respiratory illness and can cause basically a viral pneumonia, they're really very different viruses. So the flu shot will help protect you against influenza, but there's no evidence to indicate that it will actually help you with the coronavirus. However, it would be, I think, particularly important to get the flu shot this year, because both of those illnesses can present in a somewhat similar way. And we might be potentially looking at both increasing, in the winter months, like the flu always does, and it's possible that the coronavirus could start reappearing or having an increase at that time. That would be really challenging and complicated to manage, both for the risk to any given individual, as well as it would have significant implications on our healthcare system. So I would strongly recommend that people do get their flu shots this year. Okay. Yeah. So. Yeah.
Thank you, Dr. DeMille. Okay. One more, I think.
Okay. Yeah, one more question for Mayor Mauro comes from Jennifer. What are the policies for social distancing for activities in our parks? For example, is canoeing allowed at Boulevard Lake? Can we visit Wild Goose Beach?
Well, Jennifer, thank you for the question. The policies for social distancing are the same in our parks as they are anywhere else. If you're in a grocery store, if you're in a pharmacy, if you're outdoors walking on a trail, if you're in a park, wherever you are, the physical distancing rules are the same. The group of 5 policy from the province of Ontario is the same. I know Dr. DeMille will have a couple of comments to say on this as well, because it is really so very important that we just reinforce the physical distancing piece. It's the only tool we have. We've been talking from the very outset of this pandemic that we all have an individual responsibility when it comes to limiting the spread of the virus. There is not a vaccine. You can spread it even if you are asymptomatic. You can spread it if you're not taking this issue seriously, and unfortunately we do hear still from time to time that there are some people who are not taking it seriously, and that's why I found it important to talk a little bit about the enforcement piece earlier in the evening. So the rules are the same, and no matter where you are, if you're outside or if you're inside, the physical distancing piece applies. The question about, there was a piece of your question, I'm sorry, about Wild Goose Park. Is Wild Goose Park on Lakeshore Drive? I don't even know, is that the one on Lakeshore Drive in Shunya? But I would assume, I'm not sure actually if that is open or if it's closed or if there's a provincial prohibition against that. I think all outdoor rec would be captured in the same provincial order, would be my expectation. So my guess would be no, that it's not open, just like the City of Thunder Bay's would be captured in an outdoor rec capacity. Again, on that one, don't hesitate to circle back. Another piece on the Boulevard Lake as well. There will be a construction project going on at Boulevard Lake. I think it's supposed to start this year, and in fact it may be drained. So the issue related to canoeing in Boulevard Lake may not even be something. I'm not sure if that will happen this year or next, but you may not even have that opportunity. So thanks again for your question. Okay. All right. So we've come to the end. We've gone a little bit past 8 o'clock. So first of all, let me just say a lot of thank yous to a lot of people. First of all, to Dr. DeMille for taking me up on the invitation. As I said in my opening, it was important for me as a publicly elected official to have my decision making and that of council and administration informed by and guided by the professional opinions of our medical professionals. We've been reaching out and connecting with Dr. DeMille since late in January, as I've mentioned earlier. So thank you very much for your input today. I know that the community will very much appreciate it. I want to thank those of you who've taken the time to be with us here this evening as well. A number of you submitted questions. We weren't able to get to them all. But we did get to, I think, quite a few this evening. I'm not sure how many in total. Thanks to those of you who stayed online. And I would add very much through some portal with the City of Thunder Bay, I'd be very interested in your feedback. If you found this evening to be a useful tool to answer your questions, and if you're interested in us perhaps revisiting this medium again in the future, we'll consider it, and we'll look to your feedback as well. Also, I'd like to give a shout out to City Council. I know that there is some frustration with council not being able to actively participate in the meetings, and the technology that we've had so far has served us as well as it's able to serve us. I think hopefully by next Monday, council will be able to be more of a visual presence when we come to these meetings, but I know they're still very busy as well. The same questions that I'm getting from constituents, I know city councilors are, and they're doing their best and their work to stay as engaged with their constituents as they can in this very difficult time. A shout out as well to our frontline workers, to those of you who are working not just for the City of Thunder Bay, but in the hospital sector, in the community care sector. I had a difficult conversation with a woman today who's working in that sector and who's feeling she's in a situation where there's a shortage of PPE. To all of you, thank you very much. We really do appreciate this. So, Dr. DeMille, I don't know if you wanted to say anything in close, but otherwise, I'm going to sign off. I'm going to say thank you very much. We'll look forward perhaps to doing this again in the not too distant future. We appreciate it. Please, Thunder Bay, stay well, stay safe, and take very seriously this principle of physical distancing. Thank you all for spending some time with us this evening. I appreciate it. Good night.